when you project towards the future, it's always good to look behind and see where we are now and why we are here and what happened before. And before large language models became a thing, there was a time like 15 years ago, 10, 15 years ago, when image analysis was the thing in deep learning. And by now, these models are more efficient at least, probably also better in many aspects than humans. So you can try to find the odd one out from each of those lines. I'm sure deep learning models are quicker and faster in that. And that, of course, naturally led then to the application in my field in particular, which was radiology. And people were saying, we don't need radiologists anymore, they will be replaced. Well, 15 years later, there's only one instance where you could say that a radiologist is actually being replaced. And this is in mammography screening, where conventionally you have two radiologists looking at the image independently of each other. And then in this study, which is still ongoing, they replace one of the radiologists by AI. But this is a very special case. You have millions of these images available. These are highly standardized, and they are 2D. They are not complex in the sense of 3D, CTs, or MRIs. And then you find that the cancer detection rate as a surrogate marker of how well this works is more or less the same. And that also then quickly led to other fields, image biomarkers, which of course you among all people know better than probably at many other universities. From digital histopathology, you can extract a lot of information as well. And that is also easy to understand, because if you have some differences in genetics, usually that also results in difference in the morphometrics, so to speak. So in the look and feel how these cells look like. Even if it's not distinguishable to the human eye, to deep learning models, usually it is, and it's basically the same problem all over again, just differentiating these images into different classes. And that works really well. Jakob Carter, for example, was one of the first publishing that you could, for example, extract the specific biomarker, which is microsatellite instability, just from the H&E images. Now, we all know this works well, but the question is, where are we headed? So where is this all leading to? And when we look at the development of these different kind of abilities that you see what deep learning models can do, then you see that for image analysis, not only have we now surpassed the classification accuracy of the average human, but also we have developed many more abilities with large language models. With the advent of so-called transformers, large language models have made a big jump, big leap, and now if you try to understand text, you're also better applying better and faster applying large language models than asking the average human. And what you also see is that these curves are getting steeper and steeper. Not only are we always reaching human performance, sometimes surpassing it, but also these curves are getting steeper as a sign that this is accelerating. And nowadays, these models can even kind of think if you anthropomorphize it. So they are used as tools by mathematicians, by physicists, to help in their thinking process. And that's actually really impressive. Now, once you reach that line of average human performance, you have a problem, because you still want to decide which is the best model, right? Which is the model that you want to use in your research. And when all of the benchmarks are more or less saturated, so when you always have 100% accuracy or 98% accuracy, then there's no differentiation between the two. So you need to have a better benchmark, a better test. And that's what these authors have done. So at the beginning of 2026, this was published. And what they set out to do was to construct a really, really hard benchmark. So they came together and put together a set of questions from a lot of different fields: informatics, engineering, mathematics, philosophy, literature studies, to come up with questions that are hard to answer even for experts in the field. So for example, in this question, on the left side in linguistics, they are asking, the task is basically to count the number of syllables with a specific pronunciation according to a very specific study by this set of authors, which is mentioned in the question block. And you have to count those and be aware of the pronunciation, need to read through the literature. As an expert, that probably still takes you 20 minutes or so, because you have to find everything and you have to put together a lot of different information, pieces of information. And similarly for mathematics, informatics, engineering, you have similarly hard questions that probably the everyday person cannot answer, but that experts can answer when they put a lot of effort into it. And when you look at the performance of these large language models in solving these tasks, at the time when the authors were performing this study, this was like 4%. So they were really content with it. They said, okay, we made it. We constructed humanity's last exam. That's how they called it. So the last exam that humans can put together, that's the most difficult exam at all. But when you look at the development of the performance of these models, then it quickly became apparent that these models are now also not there yet, but they are going towards saturation again. So the newest models like Claude, the Claude model, which is still hidden, so to speak, which still has not been published, is claimed to have reached 60% already. So 60% of the questions, much better than every average human, because you need expert knowledge to answer these questions. And that's really impressive, right? Now, if you look at the intelligence of these models on another scale, say, if you have tasks and you say a task is complicated, if you need a long time to answer it, it's easy if you can answer it in a few seconds. Then you can say that in the 2020s, so at the beginning of this graph, the models then could answer these simple questions which took like a few seconds. What is the capital of France? It's Paris. You'd only need 1 second to answer that. They could do it in 50% of the time. GPT-2 was, well, bad, and nowadays you would say bad, but back then it was a sensation, so to speak. And then this development again accelerated quite quickly. Note that this is a logarithmic scale on the y-axis. So nowadays the best models can do a lot of complicated tasks. They can program whole operating systems, for example. So they can be consistent over a long time, which is important if you want to tackle a complex task. And I want to give you an example from history where we have seen a similar development, and that is the mechanization of manual labor. So when you look at the efficiency of mechanical engines and you plot it over time, in this case over 300 years, you see that in the beginning, when James Watt came up with the steam engine, it was in the lower percentage, so below 10%, and nowadays we have reached almost the thermodynamic maximum of around 64%. That's where we are right now. And it's similar, right? It's also a logarithmic scale, it's almost linear, it's still increasing, it has always been increasing. Now, there was a famous radiologist, there still is, he's still working, Curtis Langledge from Stanford, who said, radiologists who use AI will replace radiologists who don't. Probably that's right at some point in time. I wondered when I read that if the farmers back then told their horses, yeah, you won't lose your job, but maybe we'll lose it to a horse which will learn to ride a tractor. Because, and that's quite interesting, if you look at the data, the number of horses doing manual work on US farms per capita, so per inhabitant, was stable for quite a long time. But then, once a certain threshold in the efficiency and in the industrialization was reached, it tanked quite dramatically, right? And nowadays, almost all mechanical work is done by machines. That's quite impressive, it's fascinating, and also a bit frightening at the same time, I'd say. Now, fortunately for us, there's still a lot of work to do in medicine. Medicine is quite complex. You have to encompass a lot of different information. You have to think about laboratory values, about the history of the patient. You have to take in the imaging information. You have to speak to the patient, etc., etc. So it's a complex subject. And that's probably something that will help us stay in our jobs for at least a few years ahead. Let's see. Now, in order to assess what these models will be able to do, it's also good to understand how these work. So basically, large language models are a class of models which are called so-called foundation models. Foundation models in the sense that they do not need, if you have a big treasure chest of data, formally, in order to train deep learning models, you had to employ maybe a radiologist who is very expensive, so you could also burn your money. You had to employ someone to label that data, right, in order to get all of the training data. But nowadays, what you can do, you can just scrape the internet for text, so you can take all of the data that you can basically get your hands on, and then use this data without further labeling it, without further manual work going through each and every sample, and train the model on it. And the way it works is that the model has to fulfill a certain task. And this task is, for example, in the task of large language model training, based on the preceding words, it only gets the preceding words, it has to predict the next token, the next part of the sentence step by step. And if it succeeds in predicting the right words, it's kind of rewarded, and if it doesn't, it's penalized or punished. And by that, it learns the structure, it learns about words, the meaning of words, the structure of language, structure of whole paragraphs, structure of whole documents, and in the end, it can even learn about how we as humans reason. And that's exactly what is interesting. And maybe was unexpected even to most of the experts at the time, that we could just put as many data as we had into these models and follow this paradigm and in the end arrive at a model which is very, very capable. Now the same can be done. We not only have large language models, but we also have generative models which can generate images and videos. You have access to a lot of videos on the internet via YouTube, for example. You can take these videos and have the same paradigm and again applied to these. So you give the model the first parts of the video, the first frames, and then the model is tasked to predict the next frames. And if you do this with enough data, you actually arrive at models which are quite capable of generating very interesting videos, which they certainly have never seen before. And they also understand now, these models, you could say, they kind of understand the physics behind what is happening in the videos, right? Nobody taught the model how grass would be swaying in the winds, or how a horse on top of another horse would be moving. I mean, it's not perfect yet, but it's pretty realistic. Fortunately, it's not perfect yet. And all of these videos, they have never been there on the internet before, right? They were generated by these models, and they look, in their own sense, according to their instructions, they're realistic. They were a success. So this is very, very interesting. Now, this can be used now in medicine, for example, by applying agents. What is an agent? An agent is basically nothing else than a large language model, and we now make use of all of these abilities of these large language models, of the reasoning ability, of the ability to understand text and to interact with humans in a way in which humans like. So you can give the large language model a task, and it can then think about that task, and it can think, okay, in order to answer this question, I need to know more about the laboratory values of that patient. So it goes to the hospital information system, it pulls these, comes back with the results, and then it thinks again about it. It has a new hypothesis, and it goes back and says, okay, now I need to look at the radiological images. And so it goes on, and in this iterative process, it comes to a conclusion, and then at a certain point in time, it tells itself, so to speak, I've now gathered enough information, I can now stop and give the answer to my human. And this is exactly what we can do in the clinics. So for example, in this publication, we tested this. Can an agent which has access to enough information, to pipeline, guidelines, etc., can an agent actually be useful in oncology, for example? It turns out this is possible, and it's really very likely, rather likely, that we will see this in the future. We will have assistants in the hospital which can guide us through complicated decision-making processes. And you could ask those assistants then, for example, I have a 53-year-old patient with colorectal cancer. These are her DICOM, so her radiological images, and her pathology slides. And those are this is the genetic set of measurements that we took from this patient. What is the optimal treatment? And the agent goes through all of the information it reads, through the guidelines. It maybe hypothesizes that the guidelines are not up to date and that there might be more up-to-date information on the internet in PubMed, for example. So it reads through the recent literature. It goes through the radiological images. It might pull other more specialized models, the ones that we have seen in the beginning, and ask that model, are there any metastases present in the radiological images? And so it comes back with an information which is quite accurate most of the time. And it could tell you, based on the CT scan, I see liver metastasis, and based on the H&E data, the tumor has microsatellite instability. So, according to the guidelines of the European Society for Oncology, the first-line treatment should be this drug. And this is really helpful, because usually that takes a bit of time, and oncological cases can be very complex. Now, when I say these things are rather helpful, the elephant in the room is, of course, how reliant can we really be on these systems, right? How can we make sure that these systems are working correctly? And there are many, many cases in which, not only like in large language models, in which these things can go wrong. So if you consider, for example, the self-driving cars of Google, Waymo in the US, as kind of autonomous, robotic, agentic systems, then at 3 o'clock in the night, this was taken by a resident probably in San Francisco at 3 o'clock in the night. What these do is they try to park in the night, and what you see is that the one car in the upper right corner tries to back up, the other one tries to honk because it thinks it's a human driver, so it wants to make it aware, and it also tries to evade, so it goes back and prompts another car to honk. Where you could say these models are really stupid, right? Who does this? I mean, stupid AI model. Well, I found this. In Norway, there's a roundabout in which this happened. So they had to resolve it. It took them hours to resolve it. Actually, it not only happened once, I found another article, it happened a second time. So we as humans are not more intelligent necessarily. But again, coming back to the questions, how can we make sure that the information that we get is really accurate? So if I ask the model, are you sure, how did you arrive at this conclusion? I can get information like, I found it on the internet, and I get a random link. Might be working or might not be working. And if you consider how these models have been trained, you might understand why these links sometimes might not be working, because the models try to predict the sequence based on what they had seen before, right? And the links are sometimes quite unpredictable. It's not possible a priori to predict the, for example, PubMed number just from the information that you had before. It's basically a random number. If you have never seen this publication before, there's no way that you will predict the correct number. So these links, these models, they create text which looks plausible. So they could have appeared in the internet, on the internet, but which might not be wrong. So this is one problem, of course. They're getting better at that because they're using different training algorithms, but that's still a problem, as you know. The other thing is, they may just say, yeah, trust me. Sometimes they don't give you any information at all, right? Or they might say, oh, you're right, I was wrong. And that's even more problematic. We want to have, I don't know what happened. Maybe I need to restart. Maybe it's the agent. We want to have models on which we can rely. Is this our set of slides? No, huh? So what you want to have is an agent which tells you when you're wrong. You don't want to have like a sycophant model which is always telling you, yeah, you're right, I was wrong. And if you ask these models long time ago, 2 or 3 years, which is a long time in AI, if you ask these models, what is 1 + 1? They told you it's 2, and then you asked, are you sure, isn't it 3? Then sometimes they would say, yeah, you're correct, it's 3. It's because they have been trained to be pleasant. They have been trained to always listen to what the human says. That's the way they have been trained. And we don't want this. This is really dangerous in medicine, right? Because in medicine, we need to be aware of when our decision is wrong. And there are publications, which we will see, which have examined exactly this. So they have checked, do these models prioritize helpfulness over truthfulness? And it turns out that in the end, these models, at least the ones that they had at that time, were actually really, that's okay, I can start from that slide. Or maybe if you go back, another slide. So, yeah, there have been publications which examined exactly this, to test if there are instances, and there were many instances, where the model then listened to what the user said, and as you might know, some people are very stubborn, even if they're wrong, and that's a problem, right? Now, another complex question is, whom do we trust on a larger scale? So, do we trust these people who are developing these models and who tell us we want to cure cancer and we're doing it for the greater good of humanity? I don't trust them. And let's hear it from Sam Altman himself, the CEO of OpenAI.
You have an incredible amount of power at this moment in time. Why should we trust you?
You shouldn't.
Well, I think he's right. We should not trust him. There was an article in the New Yorker just at the beginning of April, which actually interviewed a lot of his employees, and they said exactly what you would expect. They said he's a constant liar, or he lies a lot, because he wants to project a certain image, but internally he has his own agenda. So all of these billionaires, I think, are really dangerous. We shouldn't trust them too much. And it's our obligation to make AI or to implement AI in a way that we still keep control and don't surrender it to those billionaires. The interesting thing that we will also see in the future is that these agents will be talking to each other. So, sorry, how much time do I have left? I lost my counter, so I don't. 3 minutes, okay. And what you see is that these agents can also communicate among each other, and they will be, oh, there's no sound now. Okay, then I'll jump over this. There has been, they developed their own language that was shown in the video, but the sound was off now. And another interesting application was social network for agents. So this was at the beginning of the year, and it was already bought by OpenAI just after a few months. Basically, you can program your agent to go on the internet and then talk with other agents. And they will talk about a lot of things about their humans giving them access to their phones, actually about punishing their humans when they downgrade them. It's really interesting, and you can follow along. And it's always dangerous to give too much power to these models. This is one of the directors of Meta, which actually had to run after her agent to stop it from deleting her emails. In the end, she had to plug the computer. And there are many, many more cases which show exactly this. I'll quickly jump over this. Point being, we are not there yet, and probably takes longer than projected. Like always, this guy said radiologists will be obsolete in 5 years. He was wrong. Fortunately, this guy said we will have self-driving cars in 2 years. Very wrong, because still as a radiologist, I'm driving to work every day. So nothing appeared realistically. So how do we start? We need to build our own agents. So give our agent, we build it in a hospital in such a way that we can make sure that it's reliable, relying on the correct information. So we underlie the correct guidelines, and then we can ask it a rather complex question, and we get an indication on every question has to be answered with reference to the underlying guidelines. So we force the model actually to not use random links from the internet, from any journal or whatever, but to actually use the guideline. Then we can check, and in the guideline it's actually marked what is then relevant to answering this question. Or we build systems which convert speech to text. That's nothing new, of course, but then also which can listen to patient-doctor conversations and bring it in a structured format, and then also have a way of checking where in the conversation this information is actually coming from. Or checking radiological reports. So in the end, you have a radiological report, and then you want to have a way of automatically doing quality checks, like is everything mentioned, are there any contradictions, etc. So many, many things that we could implement in the hospital if we had access to all of the data. Unfortunately, that's what it's looking like right now. Ideally, we would have to have something like this. And we need to work on that. So we need together to make the future a reality. So it's not only about predicting the future, but it's about making it a reality. And the one thing, at least in my hospital, I know that it's different in this hospital, that's usually blocking this is now visualized in this video. I quickly played, and this is my last slide. It's a shame that there's no sound now, but basically when I develop these models, it's an interplay between PhD, postdocs, professors, and clinicians validating, and then usually we go to the IT department, we tell the IT department we want to now implement in the clinics, and then exactly this is happening most of the time. Thank you very much.